So, being an ecosystem event, I thought I would talk to you today about how do we actually create a sustainable and future-proof ecosystem of health apps and connectivity. And when we kind of see this first slide here, when we think about primary care, mental health, social care, and hospital care, it kind of looks quite simple. But in reality, when we kind of try to connect all of these different systems together, we're actually faced with a picture that looks more like this. That actually it's very difficult to share information across an ecosystem. It's very difficult to connect your primary care to your social care to the hospital. And that what leads to duplication of care, it leads to lack of coordination, and it also impacts obviously upon the patient and the provider, leading to a deeply inefficient system. And so efforts to connect everybody together lead on to lots of different types of approaches. The first one is trying to connect all of these different clinical systems together. And when we try to connect these different clinical systems together, we're left with a number of different conundrums. The first one is the technical problem of connecting all of these systems together, because a lot of the times these systems don't like talking to one another. Some of these are closed systems, they don't have the technical capabilities to share information, and it gets fairly ugly fairly quickly indeed. But even if you solve the clinical system's connectivity, you're still left with a problem in terms of scale. The fact is that they don't, because the problem is that you start by connecting them together, and once you do that, you're then left with the legal problems of actually sharing that information across a system. If you exclude the patient from the clinical system connectivity, then your implied consent falls into very grey areas very quickly. So what can your hospice share about with the hospital? What can your hospital share about someone's sexual health with the mental health providers? The grey areas fall over very, very quickly indeed. And so we need a way to actually overcome the technical and the legal. But also, even if we are able to connect some of those systems together, overcome some of the legal, then does that actually scale across the country? Does it scale across the regions? Well, it only works if we're able to connect all of those systems together. And so it only works if you are able to then connect it. And that doesn't work across regions, it doesn't work across the country. It's not a scalable solution. But for me, the biggest problem with all of this is that it excludes the most important person, because that person isn't tied to a particular geography. They're not tied to a particular hospital. That patient might receive specialist care at the Christie's, Great Ormond Street. They might be in hospital. They might move house. And so actually, when we think about connecting those clinical systems together, they only work when we think about bricks and mortar. They don't work when we think about the actual patient that moves around the entire system. So an ecosystem that is built around bricks and mortar doesn't scale. But most importantly, it doesn't include the patient. And yet they're the only ones that are trying to connect everyone together. They're the ones that are trying to go to their hospital appointment and saying, my GP is prescribing this. I'm having this treatment from this specialist centre. And yet they're the only ones that are trying to connect, but they're the only ones that can't be believed because they're just the patient. And so when I go for my appointment and I say I'm taking this medication, the clinician then turns around to me and says, that's great, but I need to verify that with the source. And so we need a way to empower the patient, and we need a way for the information to travel with them. So how do we overcome that? Well, there are lots of initiatives, and we can see this from Personalised Health and Care 2020. We can see this from the 5-year forward plan, that connecting patients to their information is right at the heart of the digital strategy right across NHS England. And yet the way that we're connecting to the patient right now, again, isn't scalable. Because what we're trying to do is connect the patient to each of those different information silos. So yes, right now I am able to see my GP record. Well, in reality, I'm able to see my medications and diagnoses. But actually, that doesn't allow me to see my hospital information. If I want to see my hospital information, I have to go to a different website, a different portal. And then if I want to see my mental health or my social care information, if that's available, I have to go to yet another website. Let alone all of the fantastic apps and devices that I might be connected into. So I might download a diabetes app, or I might use the fantastic AliveCore. And so I need to go to different websites for all of those different pockets of information. So the fragmentation that we're trying to solve by connecting everyone together is actually now getting worse, not better. In the past, we had fragmentation when it was clinician-facing. Now we have fragmentation in terms of patient-facing solutions. And so this is kind of where we need to think about doing things in a slightly different way to create a connected ecosystem around the patient. And so, in a way, if I can make this work, we need to actually integrate around the patient, not integrate around a clinical system. We need to integrate around the patient and have a health information exchange of one, the patient. Because if we can connect the patient to all of those different sources of information, if we can take a copy of all of those bits of information, whether it's from an app, whether it's from a hospital, GP or wherever, if we're able to connect all of those different systems together into the patient, with them owning a copy of their information, then they overcome all of the technical and the legal problems of sharing information. And it becomes a true scalable solution because we can connect new systems wherever that patient goes into that individual. And so this is the whole premise of a patient-controlled medical record. The patient owns their copy of their information and they can give that to whoever they trust. They can give that to their family, their friends. They can walk into any hospital and share their copy of their information. It's not tied to a geography. It's not tied to an institution. It's tied to the patient. And that's kind of where Patients Know Best is looking to change the way that we connect our information together by connecting to the patient around a patient-controlled record. So how does that help everybody? And this is kind of the difference between when we think about a personal health record of patient-generated information and a patient-controlled medical record. A patient-controlled medical record is useful to everybody. It's useful to professionals because they can see what everyone else has done and they can coordinate their care. It's useful to the patient because they can connect everyone together and get the right treatment in the right way. And so when we think about a single integrated digital care record, it should be owned and controlled by the individual. Being able to have their own copy, being able to have a patient portal where all of that information comes into one place. Being able to connect everything together, as I mentioned, a health information exchange. And so not only do we need to have an integrated digital care record that's owned by the patient, we also need to be able to carry some of that information around. So being able to carry around all of our summaries, discharges, letters, reports, all of that in one place. And if we just think about the savings that we might be able to generate just from savings on paperless. And again, this is one of the key aspects of the 5-year forward view, that actually it should be paperless at the point of care. Well, that's only possible if we include the patient as that point of care. But what about consent? Well, actually, if we have the patient driving consent explicitly, then they again overcome all of our legal problems of sharing that information around the system. The patient can decide, I want to share this part of my information with this provider and not this element. So I can choose that if I unfortunately break my arm and have to go into an accident and emergency, I can choose that actually I don't need to share my sexual health information or my mental health. I need to receive treatment for that broken arm unless it's appropriate. So we can actually have the consent being driven by the patient. And that allows us to do lots of really new and exciting things. For example, it allows us to actually connect to the patient and allow them to gift that information for secondary usages. So we can start to do research with the patient's permission. We can start to connect that care together, again, with the patient's permission. So the consent engine driven by the individual, with obviously appropriate safeguards in place. So for example, a break glass functionality if you're unconscious or you lack capacity, the ability to freeze a record if there's a safeguarding issue, etc. So with the appropriate controls in place, the control should be owned by the patient. So what can you do with such a system? Well, you can start to communicate in new ways, having one system that everybody connects into, whether it's an app, whether it's a device, whether it's a hospital or whatever. Having one place allows you to connect different professionals together, which means that your clinician from Great Ormond Street can talk to your clinician in Preston, that can talk to your clinician in the Caribbean if you're on holiday. It can talk to you wherever you are, and therefore you can start to do virtualized services. So you're able to start to do virtual appointments, virtual clinics. You're able to have a scalable telehealth solution because all of those apps and devices connect into one place that everybody can see. Think of this a bit like a Facebook for health, but rather than it being a unsecure social network, this is a very secure private health network connected around the patient. Being able to track your symptoms, being able to do true co-creation around care planning. So rather than shared care planning as it is right now, which is sharing a PDF or a document around the system, actually shared care planning should be co-creation. And it's only possible to do co-creation when everybody has the ability to access the same care plan and be able to edit and inform that care plan. So we need to move from shared care planning to co-creation. So what are the benefits of this? And this is just some of the slides that NHS England and some of our own research suggest that we can get from this. So we know that 4% of all patients would avoid contact with their GP if they had an electronic system to be able to manage their care. We know that you can do twice as many Skype consultations than you can face-to-face. We know that actually 25% of long-term condition can actually be managed remotely. And we know that actually using digital solutions you can save on average £29 per patient, which is a huge sum. And even if you're able to reduce your DNAs down by 30%, which the research shows us with reminders, then you save £120 per DNA. So there are huge and compelling evidence for the way to connect everyone around their information. So a little bit about Patients Know Best and us achieving this aim right now. Well, the first thing to know about Patients Know Best, we talked about it being secure, and that's great to kind of see solutions like Orca being able to review apps and solutions to make sure that they're trusted. Firstly, PKB is the only solution of its kind that hosts all of that information behind the N3. We also have open APIs, which means that anybody can access that information who are trusted at any time. We're not open source in terms of our source code because that's not necessary, but we are completely open in terms of our interoperability. So the information is always available wherever it needs to go. We don't tie you down to using Patients Know Best because you have to, we tie you down because you want to use it. And therefore, we have security in terms of being behind the N3. So we have a unique security which is private key encryption, so only those people trusted can access that information. We're also translated into 19 languages, so you can actually switch between languages wherever you are. And in terms of our footprint, we're ranked number 1 in the world for sharing information. That's due to the Patient Information Forum that did a study. We won EU eHealth Digital Champion Award last year by the European Commission. And the EHI Best Way of Sharing Information with Patients and Carers. We're also one of the NIA, NHS England Innovation Accelerator Fellows, which is based on the NHS wanting to support those solutions that they want to take to scale across the UK. And our range of deployments range from very small niche rare diseases all the way up to big population coverage, where we're connecting in 2.3 million people across 170 providers. Or countrywide deployments such as in Ireland, where we're working with the Irish Hospice Foundation to provide end-of-life planning for every Irish citizen free of charge within 3 years. So PKB is not one of these kind of solutions that is kind of future thinking. It's actually delivering the future now. So I would like to just end on that note. Please get in contact with us. Please tweet. Please come and see us. We're very happy to kind of show a demo. I'm sure that was less than 15 minutes, I hope. So hopefully we can catch up some time. And I'm happy to take any questions that you might have now or later. Thank you very much.
Thank you, Lloyd.